I think the Psoriasis Foundation has a great story about how it got started. Ken Halprin and Beverly Foster were extraordinary people. She was in her 30s. She developed very severe psoriasis. And probably today, people don't see untreated severe cases anymore. But back in those days, you have to remember that there weren't a lot of treatments. So you would see untreated cases where 80% of the body was covered. And that was Beverly's situation. So she went to several doctors and she was frustrated, and she ended up with Ken Halprin. Ken saw in Beverly a leader, somebody who had charisma, who had passion and was compelling, had a compelling story. And he persuaded her to start the Psoriasis Society of Oregon. Her husband put an ad in the paper telling people that they were all going to meet down the library. Her phone rang off the hook, and they met down the library, and she said there were people pouring out of the room, out onto the street. They were trying to get in. So she realized that this was way beyond just meeting and talking about your psoriasis. The whole idea was to build a research organization driven by the patients and to get them involved.
There were 3 employees. It wasn't far removed from being operated around someone's kitchen table in Portland, Oregon.
Has made a huge impact on the patient care.
Allowing for more access to medications.
That started the fellowship program, and that's led to many, many other findings. Without those fellowship awards, so many careers would not have been launched.
We funded young investigators who blossomed into lifelong studiers of psoriasis.
This time, we would have patients come and testify. And that was somewhat new, believe it or not.
This was making history.
Putting psoriasis on the map in terms of awareness.
It's had a tremendous impact for my patients.
I said, you know, for me to be really helpful to you, I need to be at your board meetings because I want to make you think bigger.
This set the stage for countless discoveries made for the benefit of psoriatic disease patients.
We're not alone. There's other people there fighting for us.
Advances that we're making are amazing.
The DNA tissue bank was pivotal in changing the direction of psoriasis research.
You're really on the cutting edge and on the
There was an evolution, and I think the internet had a big say in it.
That was a key success that we had.
Out of that grows a cadre of dermatologists who will treat psoriasis in a manner that you're proud of.
Just a tremendous leader.
That's created an environment where success can beget success.
Psoriasis wasn't just related to the skin and the joints, but it also affected the cardiovascular system.
Collecting more than 3,000 genetic samples from volunteers, leading to numerous discoveries.
A pathway to a cure.
It was to build a bond with the community, to raise the visibility of psoriasis.
We've been able to help spread the word.
It really launched the NPF's involvement in genetics research.
The cusp of eventually finding that cure.
It's had a great impact for us.
We are working to improve the lives of those affected.
And they've really inspired me.
One of the key reasons the foundation has been so critical to the progress of psoriasis research and education is because the patients were driving it. I mean, who better than to drive it? I mean, they're the ones that can bring the nurses, the doctors, the general community, the government agencies, all these people together. Just as that was true when we started, which is why the foundation was successful, it's got to be true going forward.